Hello, everyone, and thank you for joining us. Bonjour et bienvenue à tous. I'd like to begin by offering my sympathies to the families of the two residents who passed away as a result of this virus that is plaguing our city, province, country, and the world. These deaths act as a sad reminder for us all to do our part in preventing the further spread of this deadly virus. In the midst of this fight against COVID-19, the City of Ottawa, like all municipalities across Canada, is having to make difficult decisions in order to live within our means. In consultation with the city's medical officer of health, the city has decided to extend the closure of its facilities and to maintain the suspension of non-essential services and programs until June 30th of this year. Changes to our operations as a result of COVID-19 are costing the City of Ottawa $1 million a day in lost revenue, and we must find solutions to protect our taxpayers and continue to provide the vital services the public expect. This decision will have an impact on the city's workforce, and our city manager will go into details shortly about what this means for certain part-time and seasonal members in recreation, culture, and facility services, as well as the Ottawa Public Library. Under this declared emergency leave, our affected employees will maintain their seniority and will be able to buy back into their owner's pension once they are back on the job. Although this is not the action we wanted to take for our dedicated employees, our human resources team deemed it was necessary to ensure their financial well-being, as it will allow these 4,280 part-time employees to apply for federal supports. I know this crisis is having a deep impact on those impacted and their families, and we will do everything in our power to treat them with the compassion and dignity they deserve during these very difficult times. I know some staff members may feel overwhelmed or anxious during these challenging times, and I want to reassure everyone that staff will still have access to the city's Employment Assistance Program, the EAP, should they need to speak to someone during their leave. On behalf of City Council and our community, I want to thank you for your hard work and dedicated service to our city. I can assure you that this is only a temporary measure. Ceci n'est qu'une mesure temporaire pendant que nous faisons face à la pandémie. I want to thank QP 503 and its leadership for working with us on this solution that protects the interests of its members. Je veux remercier le syndicat pour la collaboration dans ces décisions difficiles. In addition to extending the closure of city facilities until June 30th, we're also canceling all large events and meetings until that time. No new event permits will be issued by the city until our medical officer of health declares it safe to do so, and until our city staff can adequately support these major events. We know that this is a very difficult decision for our local festivals and our tourism industry, and I was on the phone with many of those leaders just a few moments ago, but at least it provides some degree of certainty to many who are planning events in that time frame. And we realize it's hard for our residents as well, since many of you look forward to attending these incredible festivals in your community year in and year out. Nous savons que cette décision aura un impact sur nos festivals et l'industrie du tourisme, mais c'est la bonne décision à prendre pour protéger nos résidents et les visiteurs dans la capitale nationale de notre pays. We're committed to working with event organizers to mitigate the impacts and to determine potential future dates once the public health crisis is contained and the economic recovery efforts are underway. But we know it will take the city some time to ramp up and get things back to normal, and it certainly won't happen overnight. There's no way to predict how long it will take to get our city back to full service, as it could take many months to come. We simply don't know what the situation will be on June 30th. Nous ne savons simplement pas quelle sera la situation le 30 juin de cette année. We will constantly be reviewing the situation and consulting with the medical officer of health to determine what is best for the health of our residents. And this is not easy for anyone. Cette décision n'est facile pour personne. There's no way to predict this virus, and we must remain flexible and adapt to the changing circumstances that sometimes change literally by the hour. But first and foremost, we have a duty to act responsibly and to protect our residents. Et nous devons agir de façon responsable pour protéger nos résidents. These decisions are about achieving a delicate balance with our staffing levels in these times of crises. I know our city manager and a senior leadership team will remain vigilant in the coming weeks and months to ensure we remain ready to respond. Je sais que M. Kanalakis et son équipe de direction s'assurent que nous sommes à répondre à ce nouveau défi. The reality is that our frontline workers are putting their own health at risk each time they come to work, and we need to be ready to redeploy resources accordingly if anyone were to fall ill. Sadly, the reality is we could be in this situation for an extended period of time. Cette situation pourrait durer pendant encore plusieurs mois, excusez-moi. I want to ask residents once again to please do your part to fight, to flatten the curve and stay home. Do not gather with people other than your immediate family who live in your residence. Limit your outings to the essentials like getting groceries and picking up medication. And if you do go out for fresh air or exercise, try to stay within your community and pick less busy streets and sidewalks to respect the physical distance rules. Those who do not follow these provincial orders are putting people's health at risk and prolonging this public health crisis. And unfortunately, many did just that this weekend. From Friday to Sunday, Bylaw received 526 calls because residents were not responding to orders regarding gatherings or physical distancing. This resulted in 43 tickets being issued, which is unfortunate but necessary to make certain people understand that we are all responsible to stop the spread of this deadly virus. In one case, an officer had to give 2 tickets to a resident, one for staying in a closed park and a second ticket for failing to identify himself and becoming verbally aggressive. In total, that resident was fined $2,010, $880 for not responding for the provincial order, and $1,130 for obstructing an officer. To my surprise, Bylaw even had to issue tickets to a barber shop that was still taking clients, as well as a pub that was serving seated customers. One incident I'm particularly angered by was brought to my attention through social media. A resident tore the yellow caution tape off a play structure to let others use it. I understand that these are difficult times for parents with young children, but the actions of this individual are downright selfish and could put many other children at risk. These are serious offenses in the midst of a public health crisis that we've never seen in our lifetime, which unfortunately demonstrates that not everyone is taking this as seriously as they should. And let me remind everyone that the longer these distance measures have to be in place, the more significant the impacts will be on our entire economy and the tens of thousands of jobs that were lost in our community in this last few weeks alone. As many of you know, or many of you have questions, I'm going to be hosting a virtual town hall along with Keith Eglai and Dr. Etches and other senior members of staff this coming Thursday, April 9th, starting at 2 p.m. I encourage you to visit ottawa.ca and enter the search words town hall to find out more details, including the number to call in with your questions. You'll be able to watch online at youtube.com/cityottawa, at rogerstv.com, or Rogers TV Cable 22. Again, let's all do our part to stop the spread of COVID-19. We owe it to our community, and we owe it to each other. I now hand it over to Steve Kanalakis, our city manager, who will give more details on these measures affecting our part-time and seasonal employees. Steve.
Thank you, Mayor Watson. I just lost my my thing here. Hang on a second. My apologies. I'm back. Sorry. Mon après-midi tout le monde. Before I begin, I want to take a moment to thank the city's medical officer of health, Dr. Vera Etches, for joining us today, as well as several other of our senior leaders, including Anthony DeMonte, General Manager of Emergency and Protective Services, Dan Chenier, General Manager of Recreation, Cultural and Facility Services, Danielle McDonald, Chief Executive Officer of the Ottawa Public Library, Donna Gray, General Manager of Community and Social Services, and Liz Marlin, our Director of Human Resources. As the Mayor mentioned, the city will remain in a state of emergency and extend the existing closures of city facilities, services, and large public gatherings until June 30th, 2020. These facility closures include all city recreation and cultural facilities, all city park facilities and play equipment, Ottawa Public Library branches, bookmobile stops, and homebound delivery services, the Ottawa Farmers Market at Lansdowne Park, city programs including drop-in swimming and skating sessions, as well as fitness classes. Affected city services include all City of Ottawa client service centers, licensed child care centers, including municipal child care centers and early on child and family centers. In addition, our Emergency Operations Center will continue to respond and coordinate all activities associated with keeping our city and our residents safe. Many of our employees provide invaluable services to our community by running our facilities and providing recreational and cultural programming throughout the year. However, due to the decision to extend the closure of our facilities and cancel programming, we've had to make some temporary workforce adjustments in the very best interests of our people. The city has worked in partnership with CUPE 503 to place approximately 4,000 of our part-time colleagues from the Recreation, Culture and Facility Services Department and approximately 280 of our part-time colleagues from the Ottawa Public Library on an unpaid, job-protected legislated leave of absence or declared emergency leave under the Employment Standards Act. During this period that our facilities are closed, there is insufficient work, and this negotiated agreement ensures that our people will not be laid off. This decision was necessary to ensure the financial well-being of our people. By taking this step, part-time employees will be able to apply for federal funding supports currently being offered while our facilities remain closed. I want to take this opportunity to thank James Watson, President of CUPE 503, for his collaboration in developing a plan that is in the best interests of our employees. Thank you, James. I want to assure you that these are not permanent reductions, and those impacted will retain their status as City of Ottawa employees. Right now, we need these people to sustain themselves through this period and come back ready to deliver the services and programming that hundreds of thousands of residents rely on when our facilities reopen. We're also deferring our 2020 summer student employment program until the end of May, and we'll review the viability of the program on a regular basis as the situation evolves. I want to reassure residents that the city will continue to provide essential services during this unprecedented time. Je tiens à rassurer les résidents que la ville continuera de fournir des services essentiels pendant cette période sans précédent. Our staff is hard at work on a plan that ensures that the city's finances remain stable, the municipal services continue, and that the full complement of city resources are optimized throughout this crisis. Staff will present a briefing to council on Wednesday on the city's coordinated response to the COVID-19 pandemic. I want to reiterate that the decisions made today were made to ensure the financial well-being of our people. We know that people have mortgages and rent to pay, family members to feed, and bills keep rolling in. Les gens ont des hypothèques et des loyers à payer, des membres de leur famille à nourrir, et les fractures continuent d'arriver. So we made these workforce adjustments with their best interests at heart to ensure that they can access federal supports that are currently available. But I can assure you that we all look forward to the day when we can reopen our facilities and restore our impacted services, so that we can bring back our valued employees to work. We're doing everything possible to ensure we can sustain our workforce as we move through this crisis. We have a duty to continue to provide services to our residents. We have thousands of frontline workers keeping our city running daily. This work will not stop. And to that end, I'd like to take this opportunity to thank all of our employees. À cette fin, je voudrais saisir cette occasion pour remercier tous nos employés. I know it has been an exceptionally busy time for many of you as we work collaboratively to help protect our residents and stop the spread of COVID-19. As an employer with a large workforce of frontline service staff, many of you are making personal sacrifices to the benefit of our residents. Some of you have even contracted the virus yourselves, and I and your colleagues wish you a full recovery. And to those who are working long, hard hours in new and different ways to ensure our services and supports continue to run, I want to thank you for your efforts. I know that now more than ever, we will all come together as a community and we'll be stronger at the other side of this. As the city continues to work around the clock to support residents and keep Ottawa safe, I'd also like to remind our residents that you have a role to play in this response. Please stay home when you can. Limit your travel to only the essentials. We need you to follow the instructions of Ottawa Public Health and our federal and provincial health authorities, not only to keep you, your families and your neighbors safe, non seulement pour assurer votre sécurité, mais aussi celle de vos familles et de vos voisins, but also to protect our frontline workers who are out every day supporting you in your city. We all have a role in this, so please do your part. Nous avons tous un rôle à jouer à cet égard, alors, s'il vous plaît, faites votre part. I would like to now invite Dr. Etches to make some remarks. Thank you, Mr. Mayor.
Thank you. As of 4 p.m. yesterday, Ottawa Public Health is investigating 370 lab-confirmed cases in the community and 7 outbreaks in institutions. That's 48 new cases since our last report on Saturday. And we also have 56 resolved cases. Depuis hier, à 16 heures, SPO inquiète sur 370 cas confirmés en laboratoire à Ottawa, dans la communauté, et sur 7 éclosions institutionnelles. Il s'agit de 48 nouveaux cas depuis notre dernier rapport, samedi. On a aussi 56 cas résolus. So the number of people hospitalized and in intensive care also changes daily. There are currently 30 people in hospital and 14 of them are in ICU. Le nombre de personnes hospitalisées et en soins intensifs change aussi chaque jour. Il y a actuellement 30 personnes à l'hôpital et 14 d'entre elles sont en soins intensifs. Sadly, 6 people have now died in Ottawa. And of these, 5 were over the age of 65 years of age, and 1 was between 45 and 64 years old. There were 3 males and 3 females. And as a reminder, we are putting more of this information on the Ottawa Public Health website, so there's more specific information there. I do want to echo Mr. Kanalakis's and Mayor Watson's comments about the decision to close city facilities until the end of June not being taken lightly. This is an important time right now for all of us to continue to change what happens into the future. If we can do our part to change the curve, plank the curve, as they say, flatten it right down, then we'll be able to have more informed decisions into the future. It is clear that the actions we take now will make a difference. They are making a difference, and there would be more COVID-19 infections in our community now if we weren't doing our part. As the mayor, Mr. Kanalakis, said, this is not easy. It's hard staying home. People can feel lonely and anxious, and so I do encourage people to find ways to continue to connect virtually through technology. On reconnaît que ce n'est pas facile. Les journées peuvent sembler très longues quand on reste à la maison. Vous vous sentez peut-être seul ou anxieux. Je vous encourage à trouver des moyens de continuer de prendre contact avec vos amis, votre famille ou vos voisins en prenant avantage de la technologie. And the Distress Center is available to provide support. If you need someone to talk to, call 613-238-3311. We also recognize, and again, as others have said, that financial pressures are making the situation much more difficult. And so I really appreciate that all levels of government are taking steps to help. Please visit ottawa.ca for more information on the financial resources that can be of assistance. And finally, I want to share that the COVID-19 Care Clinic opened today in Ottawa's West End. It was under the leadership of the Queensway Carleton Hospital and the Champlain Health Region Incident Command. So the clinic involves the City of Ottawa, CHEO, primary care physicians, community pediatricians, and the regional COVID-19 planning team. It's equipped to do basic diagnostic tests like the COVID test, chest x-rays, and lab tests. It is located at 595 Rudy Drive, and it will be operating from 9 a.m. to 4 p.m. Monday to Friday. Une clinique de soins COVID-19 est maintenant ouverte dans l'ouest d'Ottawa. Située à 595 Promenade Moody, cette clinique implique la ville d'Ottawa, le centre hospitalisé des enfants, les médecins de soins primaires, les pédiatres communautaires et l'équipe régionale de planification COVID-19. Elle est équipée pour effectuer des tests de diagnostic de base, tels que des radiographies pulmonaires et des tests de laboratoire, les dépistages pour COVID-19 aussi. Residents should go to the COVID-19 care clinics if they have escalating symptoms of respiratory illness. So if they have a worsening cough, worsening flu-like symptoms, and they're in need of medical attention. Residents do not need to be tested before going to the care clinic. This care clinic will help people get the treatment they require for respiratory illness, and it will help keep our emergency departments for emergencies. I want to thank everybody for doing their part to reduce the spread of COVID-19. This is easier when we're all in it together, and the difference we make, physical distancing, is important. Merci.
Thank you, everyone. Merci à tous. I will quickly do a roll call to see which agencies are on the line. If I have missed anyone, please let me know. Je vais confirmer les noms des médias qui sont en attente. Si j'ai oublié quelqu'un, s'il vous plaît, me laissez savoir.
Je peux l'activer.
Alors, 104.7, Mathieu Loca.
Oui, confirmé.
1310 News. 1310 News, Chris Curries. Canadian Press, Laura Osman.
Here.
CBC.
Here.
CTV.
Here.
Is that Josh Pringle?
Yes, it is.
Le Droit.
Oui, présent.
Julien, c'est ça?
Oui.
Orleans Star, Fred Sherwin.
Here.
And who do we have from Ottawa Citizen?
Hi, Candace. John Willing.
Hi, John. And Ottawa Sun, my apologies. Radio-Canada?
Oui, je suis là.
C'est à qui je parle?
À Kim.
Merci. Do we have TVA? Est-ce qu'on a TVA?
Oui, je suis là. Est-ce que vous m'entendez?
Kenza, merci beaucoup.
Merci.
Have I missed a news agency? Est-ce que j'ai manqué quelqu'un? Okay. Again, a reminder to remain on mute until it's your turn. I will now invite each agency alphabetically.
And here.
Salut Benoît, je pense qu'on va partir côté météo pour quelques jours. Ben, on a eu une très belle journée aujourd'hui. 13 degrés présentement, le soleil, je vais faire un discours avec la norme. Je crois que beaucoup de gens qui ont pris les petites marches aujourd'hui.
Sorry, everybody. I will begin with Mathieu Leca, 104.7.
Oui, ma question s'adresse au maire Watson. Pourriez-vous répéter en français les coupures que vous faites et puis les pertes financières pour la ville?
Oui, certainement. On estime que la ville perd 1 million de dollars chaque jour parce que maintenant, on n'avait pas beaucoup des passagers pour aussi transport, par exemple. La même chose avec les cours pour le département de récréation et culture. Alors, ça, c'est une situation très sérieuse. Et ça, c'est une des raisons qu'on a annoncé aujourd'hui que malheureusement, c'est nécessaire d'annoncer que presque 4200 employés temps partiel et saisonnels vont perdre leurs emplois pour le moment. Ils sont toujours les membres du personnel, mais malheureusement, c'est nécessaire d'arrêter leur emploiement pour les prochains quelques mois. C'est une décision très difficile, mais comme tu sais, on n'offre pas des courses de nager ou patiner. Et tous les employés sont des employés qui travaillent pendant l'été, par exemple, ou qui sont des employés temps partiel, qui offrent des cours, font des choses dans les parcs et des choses comme ça.
Est-ce qu'on a une relance?
Oui, vous pouvez faire un suivi.
Est-ce que ça veut dire que pour la saison touristique, c'est game over?
Excusez-moi, répétez la question, s'il vous plaît.
Est-ce que ça veut dire que pour la saison touristique, là, tout arrête jusqu'au 30 juin? Est-ce qu'on peut dire que c'est game over pour la saison touristique à Ottawa? Est-ce qu'il n'y en aura pas?
Bien, j'espère que non, mais la situation maintenant est qu'avec le conseil de Dr. Etches, on a décidé d'annuler toutes les activités, les grandes activités jusqu'à le 30 juin. Et avant cette date, on va décider est-ce que c'est nécessaire d'ajouter un autre mois ou 2 mois pour ça. C'est vraiment difficile pour nous autres parce que tout le monde ne connaît pas la fin de COVID-19. Mais certainement pour les activités, les grandes activités, par exemple, le Festival des Tulipes, malheureusement, c'est annulé pour cette année. Et on va décider est-ce que c'est possible d'offrir des autres festivals après le 1er juillet. Pour le moment, on n'avait pas une réponse, mais on va décider avec le conseil de Dr. Etches et son équipe.
Merci.
C'est dommage parce que c'est vraiment une des choses les plus importantes pour l'industrie touristique, les festivals pendant les étés. Et il y a beaucoup de travail les groupes et les bénévoles et des membres personnels de tous les festivals font pour comment est-ce qu'on dit, créer des festivals uniques et spéciaux. Mais la chose la plus importante est la santé de tous les résidents. Et c'est la raison qu'on a annoncé les dates de 30 juin aujourd'hui. Merci.
Merci beaucoup. Now we have 1310 News, Chris Curries. Do we have Chris Curries on the line? No?
I'm just going to jump in real quick. It's Taylor from The Sun. I just want to say I'm here. I don't think anyone heard me earlier.
Okay, thank you, Taylor.
I'll wait my turn. Thanks.
Okay, so do we have Canadian Press, Laura Osman, on the line?
Here. Hey there. Mr. Mayor, I wanted to ask you about, and perhaps Steve Kanalakis as well, what is the current thinking on closing lanes of traffic to make more room for pedestrians in areas where sidewalks are quite narrow so that people can keep that 2-meter distance?
Yeah, I think I'll start off and then maybe Steve or Tony can offer a comment as well. To date, we have not done that. We're trying to encourage people if they want to go out and some fresh air, walk or run to use streets that are less busy. We've indicated that if there's a need, for instance, there's bunching that takes place outside a particular business that's still open, for instance, a pharmacy or a drugstore, that we'd be prepared to offer some kind of a bump out on one section of the road so that we allow people to go in and out of those grocery stores. Or another good example is the bridge between Old Ottawa, South Glebe. Happy to look at expanding that to allow for pedestrian access. But to date, the suggestion of closing all of Bank Street or a good portion of Bank Street has not been supported by our emergency operations committee. There have also been some suggestions that we close various parkways. As you know, all the parkway system is owned and operated by the NCC. It's not the city's decision. And the last word we had from the NCC was that they were not prepared to do that. So we've indicated that obviously, people need to get some fresh air. Their kids have to go out. Try traveling on the less busy streets. You don't go to the busiest street in a particular neighborhood if you want to maintain a safe distance. And I think, Dr. Etches has been insistent on that. We have to practice good physical distance on the one hand, but obviously we want people to go out and get some fresh air. The difference is, of course, and sadly, we had to issue a number of tickets for people who were disobeying the rules in parks. As you know, the province has mandated that all parks be closed. What we've tried to do to be as reasonable as possible is allow people to walk through, run through, or cycle through the parks, but not hang around the parks. And that's where the ticketing begins. And it's a pretty steep fine set by the province, but it has to be done because we've been given 2 weeks at least of warnings and gradually upping the severity. And I fully support our bylaw officers going and enforcing this law, because the more people that disobey, the more likelihood that there's going to be another case and another dozen cases of COVID-19 that we're trying to eliminate. So I think the vast majority of Ottawa residents have been very reasonable. They followed the physical distance rules, but there are some that continue to disobey, and that's why they've been given tickets. And they'll now, if they want to appeal those, will go into the judicial system. I know, Steve, if you wanted to add anything else to that. I think, yeah, you're on mute there, Steve.
Yeah, well, thank you, Mayor. No, I have nothing else to add, Mayor. I think you captured it perfectly. Thank you.
Thank you, Laura. Do you have a follow-up?
I do. Just as a quick follow-up, what is the concern that emergency services had? And are there any concerns about people walking out into traffic, for example, in the meantime?
Tony, did you're on the Emergency Operations Committee. I know it's a bus route, it's a fire route as well, I believe.
So in essence, that is for both those reasons, as well as we are focusing, and today, we're losing colleagues that are going to be away temporarily. The resources that we have are focused on assisting Dr. Etches and all of us, fighting this COVID issue that we have, instead of, having assets. So when one closes the road, you have to do analysis about the road closure itself. You have to put bollards for security reasons, as you talk to ensure that pedestrians don't walk in the traffic. So for all those issues, the cause and effect and the balance of that resource intense requirement, we would prefer that both the bus route and the emergency route stay clear, and we don't have to put all those assets right now. And I think there's other solutions in the community that allow people to walk around and get some fresh air, and not necessarily need the intense work to be able to close off streets.
Thank you.
Thank you, Laura.
Not sure it was just me, but Tony's sound was quite weak. Maybe I'm just not hearing it properly, but if people could speak up, that would be great. Thank you.
Thank you, Mr. Mayor. We will move on to CBC. Who do we have from CBC?
Hi, it's Joanne Canello.
Hi, Joanne.
Hi, either for Mayor Watson, or perhaps Steve Kanellakis, a little bit more on the finances. The people that you are letting go, I was wondering how much that will save for the city. What's happening with the OC Transpo buses and bus drivers, I should say. If there's less service, or I'm sorry, a reduced service. And if you could just talk a little bit more about the city's finances in general. Thank you.
Yeah, I think, Steve, we talked about what the savings would be. Do you want to give that information to Joanne, please?
Yeah, thank you, Mayor. Yeah, Joanne, the numbers right now, the part-time staff, it's a savings of about $2.7 million a month on the expenditure side. We're bringing a full presentation to council on Wednesday to give the bigger picture, because there's so many moving parts on city finances. There's revenue impacts, as the mayor said, it's about $1 million a day in revenue. Our expenditures are something that we have to try and reduce and slow down as we go. It's a big uphill battle to do that. With respect to other workers, the worry that we have, and the thing that we're focusing on our emergency operations control group, and that I'm very engaged in, is the notion that if this goes on a significant period of time, we need to have staff in reserve to be able to continue to deliver services for the city of Ottawa, and that means that you can't let people go. We know our employees are going to get sick. We know that we're going to have reduced service levels. We possibly could have a flood. We're still monitoring that over the next month. And even on OC Transpo, they're starting to feel the impact of, they've had some cases, obviously, as you've heard, reported of some of their operators. We need to make sure we have operators ready to come back and fill in and continue the operations as we start ramping up. So we're really monitoring the whole notion of redeployment of staff in areas where we're falling short because of illness or other personal situations that are happening, emergency leave. And we're trying to maintain the long term so that we always have staff available to be able to jump in and take on various jobs so that we're not leaving the public short. And we want to make sure that staff are in a position to be able to start ramping up as we start coming out of this over the next several months. So the picture you're going to hear financially, Wendy Stephenson, our CFO, is going to be providing council with an overview of all the considerations that are in play right now and some of the mitigation strategies.
And thank you, Mr. Kanellakis. And just as a follow-up on on the fines that Mr. DeMonte was talking about and the mayor. Mayor, you gave some pretty egregious examples of what people were doing, but we've also heard in the media of some people who are just like, someone was sitting on a bench by themselves. Technically, I know not allowed, but she got an $800 fine. And now she says she doesn't even know how to appeal that because on the back of her ticket, it says she has 15 days to appeal it, but the courts are closed. So I'm wondering if there's any a little bit of latitude with people who are not repeat offenders or meeting in groups, and also how people can actually take that to the court system if they want to, as the courts are not dealing with these issues.
Yeah, I'll ask Tony to comment on a couple of those aspects, but I was briefed by staff today. The officers use discretion. They don't simply walk in and they see someone walking in a park and immediately give them a ticket. There's always, as you know, Joanne, two sides to every story. If we listen to every story that came on Twitter, we'd think, the bylaw people have run amok. They actually observe and they're trained to be reasonable. But at the end of the day, if someone is in the park, I'll give you a good example. When someone said, it's just one person. Someone wrote to me and said, I have a field near my house, and over the weekend, 2 children from the same family started playing together. Seems innocent enough. Within the hour, there were 6 additional children from the neighborhood. These are tough and difficult times to stay home, but necessary for everyone. So I think, the challenge we have is that warnings were not working. We've seen a ramp up of the number of phone calls, I think over 500 just in the last weekend. So Tony, do you want to comment with respect to the court process?
Sure. There's a challenge with regards to the court process. There's a 1-800 number, but we're working with the courts to see how that follow-up can be done. So those delays will be taken into account. But Joanne, I want to just reiterate that the mayor talked earlier, Dr. Etches and her team told us why this thing we have to do physical distancing and put these elements in place. We indicated to everybody that we would be out there enforcing in the first weeks. We're going to be, talking and educating people, which we continue to do, and we will continue to do. But we also told people that we would move to enforcement. And as the mayor said earlier, and others have said earlier as well, the vast majority of people are doing their part in adapting to this new reality. Just to put things in perspective, it sounds like we're ticketing everybody. Of the 526 requests we had through 311 that we attended from Friday to Sunday, only 43 tickets were issued because, as the mayor indicated, there's 2 sides to every story, and judgment was used on each of those. All the others were warnings or education, if you want to put it that way. So I think the bylaw team is doing a very reasonable job. Certainly when somebody does finally get a fine, they're never happy, but those were justified, and people in general, once they're educated, understand, and we have no issues. The egregious cases that the mayor was talking about, I think are quite serious. Barbershop that's open and there's patrons sitting in the same small room. The pub that has people sitting at tables having a pint. It's completely inappropriate. We know it's inappropriate, and this will have consequences and impacts down the road for our community. So I mean, we're going to continue to enforce, and things will increase if people aren't paying attention.
Okay, thanks. I just want to mention, though, Mr. DeMonte, it's a bit difficult to hear you. I think we got the gist, but just so you know. So thank you.
Thank you, Joanne. We will now move on to CTV Josh Pringle. Sorry, there we go.
Just following up on what Joanne was asking, can we get some clarification? Are people just allowed to walk through parks, and if they deviate off the path or something like that, that's when there could possibly be a fine? Because we did get complaints from people saying they were just walking the dog or whatever, and all of a sudden got a ticket today.
Go ahead, Mayor.
No, go aheid, Tony.
I'll try. Can you hear me a little bit better now? I'm going to try to speak up.
I can hear you much better.
Okay, yeah, perfect. Glad. No, it's not just walking the dog. So as the mayor said, each of these cases, the bylaw officers investigate, for lack of a better term, but ensure that people are not loitering. And so, yes, you should be walking through the park. You should be enjoying that space and taking air, etc. But not loitering in the park, not playing with your dog in the park, not going on the berm and throwing stick in the water for the dog to hang out. That's not appropriate. You should be walking through the park and on your way. And we intervene and ask people to do that. And then, sometimes there's other discussions that take place. And again, under the officer's discretion, measures sometimes have to be taken.
And just a follow-up question, looking ahead, June 30th, with city no longer issuing permits, what does this do for Canada Day activities right now, or is it still too early to say?
So I think the mayor's trying to talk. You're on mute, Mayor. There you go.
Yeah.
There we go, Mr. Mayor.
Yeah, just on that issue, obviously the big Canada Day celebration is organized by the federal government and the Canadian Heritage Department. We've made a decision up until June 30th. I think it's going to be a real challenge. Obviously, I'm not sure if, between June 30th and July 1st, there's going to be a big difference in terms of us dealing with this virus successfully and eliminating the risk to the public. So I know a number of smaller communities and larger communities in Ottawa have always had plans to have Canada Day celebrations. I wish we could give you a more definitive answer, but we can't. My best advice is certainly for the community groups not to incur any or very few expenses because there is a likelihood that July 1st celebrations would not take place, and you would be wasting a significant amount of resources and money. If you can, keep organizing without incurring costs and then make the decision go or no go once we come up with a new date, if we have to do that, then proceed accordingly. Tony?
Yes, Mayor. I had a conversation today with some of the special events community group indicating that we were going to delay till the 30th of June. They understand and are supportive of our decision and understand what it means with regards to Heritage Canada. We've made them aware of the June 30th date, and I think they're going to take that into their planning and decide what they wish to do.
Thank you. We will move on to Molly from the Globe and Mail. Are you on the line?
Yeah, can you hear me okay?
Yes, thank you.
Okay. Apologies if this has already been asked. I'm just I'm late to the table and was just given the link now. But I had a question about the ticketing that occurred in the city over the weekend, and I'm just hoping to get some clarity. The Canadian Civil Liberties Association has drafted a letter, kind of criticizing what they see as some heavy-handedness, particularly around people being in parks or lots or whatever, as provided they're the appropriate distance from others. So I'm hoping to get some clarity. Moving forward, are people allowed to be in a park, to let their kid or dog run around for half an hour, provided they abide by the social distancing guidelines?
So under the provincial order, as well as our municipal rules, the parks are closed. We're permitting people to walk through the parks for their mental health and just to be able to get out. So they should be walking through the park. They shouldn't stay in the park, and they shouldn't be doing activities within the park. That's not appropriate. And yes, I know we got a letter and we'll be responding accordingly. But again, I just want to reiterate, and perhaps you didn't hear it, one of your colleagues asked earlier, from Friday to Sunday, we had 526 active requests that we attended. So we got much more than that, but those that we attended, 526. And we only issued 43 citations, of which some were businesses. We talked earlier, a barbershop that was open, a pub that was serving people at tables. That's all within those total numbers. So that's less than 8% of the total calls that we intervene. Most of the time it was education, and we continue to use judgment. The objective here is the same objective that our medical officer of health and the scientific literature showing. We need to stay home, we need to distance, and we have to do everything as a community to ensure that we're able to turn this thing around. And enforcement is another tool. We've been communicating that to everybody. We've been intervening the past few weeks just with education, and now we've gone a step further. We continue to educate, but in certain cases we will be issuing fines. The tool is there, and we'll continue to do that.
If I could just offer a comment as well. Tony touched on it briefly, but this is a provincial regulation that has been adopted. This is a province-wide, and in fact, the city is being a little more lenient than most other municipalities by allowing people to walk through without stopping, without playing with your kids or your dog, just walk through to get some fresh air. That's fine. But our officers, when they find people holding beach volleyball tournaments and engaged in large groups, then tickets will have to be issued. And with all due respect to the civil liberties letter that I think was sent by social media, I haven't seen it in my own inbox. This is a public health issue. And we've been told by medical experts like Dr. Etches and others that it does not make good, healthy sense to have people congregating in public spaces. And as I said, the province has indicated very strictly that parks are to be closed, and ours are closed. You know, we've had one woman go and tear down all the yellow tape around a playground structure so the kids could play on it. Well, that really is not acceptable because it is continuing to spread the virus that we're trying to eliminate.
Right. I don't know that those are the cases they're referring to. I think, you know, everyone would acknowledge certainly there's, you know, people who are flagrantly disobeying, but, you know, is there any potential for review or discussion with the officers moving forward about cases where, you know, maybe it was a little heavy-handed?
Well, ultimately, that's up to the court to decide. Our officers use their discretion. They don't simply go in and they see one person. They have to observe for a period of time. And, you know, as Tony pointed out, we had over 500 calls of complaint and we issued fewer than 50 tickets. So the officers are using education. But we tried that for 2 weeks without any ticketing. And you may have missed what Tony had said earlier, but we had a bar that was open. We had a garage sale. We had kids' birthday parties. We had a barber, a women's hairdressing salon. And this has to stop because it is causing the continuation of every day. Dr. Etches gives a report. There are more deaths and more people afflicted with COVID-19.
Thank you.
Thank you, Molly. Maintenant, on va aller à Julien Paquette au droit.
Oui, bonjour. Question pour Dr. Etches. Je voulais peut-être avoir, je ne sais pas si vous avez des données disponibles sur cette première journée de la clinique sur la promenade Moody. Comment est-ce que les gens se sont déplacés pour se rendre déjà?
J'ai pas entendu tous les mots, mais vous voulez avoir plus d'informations sur la clinique?
Oui, puis est-ce que la fréquentation aujourd'hui, est-ce qu'il y a des gens qui...
OK. Je ne sais pas si c'était le premier jour aujourd'hui pour la clinique à l'ouest d'Ottawa. Si vous voulez avoir le nom pour dépistage à Brewer Arena aussi, c'est normalement comme 200, entre 200 et 300. Alors, le numéro de visiteurs pour la nouvelle clinique, on verra à la fin de la journée.
OK. Mais est-ce que vous êtes en mesure déjà de nous donner une idée de comment ça s'est passé? Parce qu'on disait qu'il y avait une possibilité qu'on puisse ouvrir une autre clinique rapidement si c'était débordé. Est-ce que il y avait beaucoup de gens qui se sont déplacés aujourd'hui jusqu'à maintenant? Sans donner de chiffres exacts.
Oui, malheureusement, je suis dans des réunions toute la journée, alors je n'ai pas reçu une mise à jour concernant la clinique à l'ouest, mais je peux faire une demande et faire le suivi avec vous après si vous voulez avoir les noms.
OK, parfait, merci beaucoup.
Merci, Julien. We will now move on to Fred Sherwin at the Orleans Star.
Yes, I'm just wondering about how these losses will be made up. Because the federal government doesn't move in to help bail out the cities. And I assume the city doesn't have a whole lot of money in its discretionary reserve funds. Would it be possible, it's easy for the mayor, for Steve, would it be possible to issue?
Oh.
I think we lost you, Fred.
Sorry, Fred, I think we lost connectivity. Can you hear us? Okay, I will come back to you, Fred. We'll move on now to Ottawa citizen John Willing.
I think it's a question for Anthony DeMonte. Anthony, can bylaw officers ticket people on federal lands in the city, so that being the Canal Side Paths and along the Sir John Parkway?
Yeah, so we do have agreements with them, and in this case, we've had some discussions with the NCC. They have their own enforcement officers that do that job as well too, but we're assisting them.
Okay, just for clarification, Anthony, have any of your officers written COVID-related tickets on NCC land?
That's a question I'm sorry I don't have the answer to if any of those charges were on NCC land, but I can get back to you, John, to validate that.
Thank you. Just a follow-up, I guess a question for Steve Kanellakis. Steve, what else is on the table in terms of finding savings for the 2020 budget year? We've learned today of the temporary layoffs for part-time workers. What else is on the table going into Wednesday's council meeting?
Oops, I think Steve, you're on mute.
I'm off there now. Thank you. John, my preference would be that, in fairness, council needs to be briefed on that first on Wednesday before we start discussing what those options are and what we're looking at. That review's happening over the next couple of weeks, and on Wednesday we're going to be laying out the areas that we could look at to try and make up some of that shortfall. But we recognize that we're not going to be able to make all of it up before year end, considering we're into April already.
I think just to follow up on Steve's point, John, don't expect a long list of specific areas that are going to be targeted for reduction. I think we're looking at the bigger picture through the Treasurer's presentation in terms of possible areas of efficiencies and so on. So there's not going to be a specific list. I think the decision we made today, like almost every municipality has made or is in the process of making across Canada, is that we had to make this move because obviously the individuals who are affected in the part-time and casual and seasonal work pool, there are no pools open, so we don't need lifeguards. There are no arenas open, so we don't need people to run the Zamboni or teach skating lessons. So unfortunate that we have to do this, but every other city across Canada is doing it. And this is one way of saving some dollars with minimal impact to the public because these services are not available. And just a reminder that these individuals will be called back as quickly as possible once the facilities start to open, once we're through COVID-19. Thank you.
Thank you, Mr. Mayor. Thank you, Steve. We will now move on to, let's try Fred Sherwin again. Fred, are you on the line?
Yeah, I'm back on. I think I got disconnected 3 times in the last 50 minutes. The question I was asking was about potentially how we're going to pay for this. I'm assuming the city and other cities are going to be looking at hopefully some federal government funds. But if not, I also assume the city doesn't have a whole lot of money in its discretionary reserve fund. I was just asking Steve, would the city consider issuing emergency debentures? Is that a possibility?
Actually, Fred, we can't issue debentures for debt. The way the Municipal Act is set up, the city has to self-finance. So that's kind of one of the great things about municipalities is we have to stay out of financial trouble because if we do run a deficit, we have to self-fund it from our reserves. So there's no ability right now to issue debt like the federal and provincial government do to cover off deficits that they run up in the year. So we have to find it from within, or we need help from the federal and provincial government. And the mayor can speak to this. I know he's active with the large urban mayors caucus, and they're meeting weekly to talk about advocacy and discussions with the federal and provincial levels of government in terms of what comes next. Mr. Mayor.
Yeah, thanks, Steve, and thanks, Fred. The issue has been raised every meeting that we've had with the Big City Mayors Caucus, which is once a week, usually on Sunday evenings, usually with the Deputy Prime Minister, and then last week we had Minister Catherine McKenna. And all mayors brought forward the challenge that we're facing, both in terms of infrastructure projects and how they'll be impacted with COVID-19, but also the operating challenges that we're all facing because this is a multi-$100 million problem across the country. So we haven't reached any solid conclusion with respect to financial help from the other 2 orders of government, but certainly they are well aware of our need. And they have been very empathetic and sympathetic to the fact that we are the ones delivering the frontline services during this crisis and racking up a significant, large bill for everything from public health to police, fire, paramedic overtime, public works folks, and hydro people. So the discussion has started. We haven't reached, obviously, any conclusion in terms of how or if they will fund us, but my sense is they're willing to sit down and listen to our story, because I think it's a compelling story. We obviously can't plan for something like this, and we have limits in terms of what we can do, because as Steve said, we can't run a deficit, and we have caps in terms of the amount of debenture that we can issue for capital projects only.
As a follow-up, then, is it possible that the city could run out of money for operating? And how deep are the city's pockets? How long could the city go without any funding from the upper tiers of government?
Well, Fred, we've done that analysis, because the issue for us now is, like businesses, it's a cash flow situation. Can we continue paying for all the services we need to deliver to our residents? And our CFO has done that analysis, and the city has enough in its reserves and enough money coming in to be able to maintain our cash flow through the end of the year. The issue is going to be is that we're going to have a gap, because cash flow is very different from where we end up at the end of the year. We're going to have a significant gap in terms of what we budgeted and what we collected and what we're spending, and therefore you're going to have a significant deficit by year end.
And just to follow up on that as well, as you know, we're offering those people who are in hardship cases the ability to defer rather their property taxes from the June final installment to October. And at this point, because we just opened applications at ottawa.ca for people to apply for that hardship deferral, we don't know how many people are going to defer till October. So that means a certain amount of money lost in interest, although interest rates are relatively low, so it's not a large amount. But we will, I'm sure, have some people that will not be paying their taxes in October, and that's going to have a direct impact on our ability to continue to operate the services. But as Steve pointed out, we do have relatively good reserves, but many of those reserves are dedicated to certain tasks. You can't take the water and sewer reserve and put it into another department, for instance, to help with financial crunch.
Thank you very much, Mr. Mayor. We will now move on to Taylor Blewett at the Ottawa Sun.
This is a question for Dr. Etches about the 6 people who have died. We know that the first individual to pass away was living at home. The next 2 were residents of the Promenade, retirement residents. Can you speak to whether the 3 most recent deaths were associated with a particular local institution, and if so, which one or ones?
Right. No, the most recent 3 deaths are not associated with an institution, and in terms of the declared outbreaks that we have shared with you. So there are other residents in the community.
And I noticed on the OPH website where the institutional outbreaks are listed, there are 5 outbreaks of different institutions that are described just as respiratory infection unspecified. And I'm wondering just why that is, and like, are these situations that could turn out to be COVID-19?
I probably can't say specifically. I'm not looking at the same thing you're looking at, but typically any time we go through the year, there are respiratory outbreaks, and sometimes, often actually, we aren't able to detect which virus it is that causes that. Sometimes we can tell it's influenza. There are other viruses out there, respiratory syncytial viruses, and so we aren't always able to determine which virus, but we put in place the measures that are required to stop a respiratory outbreak. Everyone in a respiratory outbreak who has symptoms will be tested for COVID-19. So that is the direction. That is what we're doing. So it would mean if that hasn't been identified, then it may still be unspecified.
Thanks.
Thank you, Taylor. Maintenant, nous allons aller à Kim de Radio-Canada.
Oui, merci. Ma question est pour le maire. Ma première question, vous en avez parlé en anglais de l'impact de la décision de ne pas permettre les rassemblements publics jusqu'au 30 juin. Quel impact ça peut avoir ça, sur la fête du Canada et sur d'autres grands festivals qui doivent se préparer dans l'incertitude, par exemple le Blues Fest plus tard cet été à Ottawa?
Oui, c'est une bonne question et une difficile question. Certainement, les grands événements comme le Festival des Tulipes, par exemple, le Festival Jazz qui est dans le calendrier avant le 30 juin. Les choses comme ça sont annulées pour cette année. C'est dommage parce que ce festival est très important pour l'esprit de notre vie et pour certainement le développement économique pour la ville d'Ottawa. Mais après le 30 juin, on n'avait pas une réponse claire pour le moment. On va décider avec une consultation avec Dr. Etches et son équipe dans un mois ou un mois et demi, parce que c'est impossible pour nous autres de connaître le fin de COVID-19. Et la raison qu'on a donné le 30 juin est de donner les groupes qui avaient des festivals pendant cette période un avis pour annuler leurs contrats et leurs activités. Comme j'ai dit, je parlais avec beaucoup des personnes dans ce secteur pendant les derniers quelques jours. C'est vraiment une situation triste, mais c'est la réponse et la bonne réponse parce que maintenant, on avait une crise dans la communauté à cause de COVID-19 et c'est le temps pour donner la direction claire que c'est nécessaire d'annuler des festivals jusqu'à le 30 juin. Et on va décider probablement dans le mois de mai une nouvelle date si ça c'est nécessaire.
Parfait. Vous parlez de mesures nécessaires, justement. On vous en avez beaucoup parlé en anglais avec les amendes qui ont été distribuées au cours de la fin de semaine. Les gens ne semblent pas avoir de direction claire sur ce qu'ils ont droit, ce qu'ils n'ont pas droit de faire dans les parcs de la capitale nationale. Est-ce que vous pouvez nous expliquer un peu de façon claire ce que les gens ont droit de faire et de ne pas faire?
Oui, et Tony Demonte va donner plus d'informations, mais la province de l'Ontario, il y a quelques semaines, a déterminé que tous les parcs provinciaux, municipaux seront fermés. On a donné la permission à des personnes de marcher ou dans un parc, n'arrêtent pas, ne jouent pas dans le parc, mais utilisent cette parc pour un passage à une autre communauté. Alors, c'est vraiment clair. Les parcs sont fermés pour des activités, mais vous avez le droit de marcher dans un parc, mais pas jouer, pas rester, pas arrêter. Tony?
C'est exact, M. le maire. Donc, l'ensemble des parcs et des activités récréatives dans les parcs sont fermés. Par contre, vous avez le droit de traverser à travers un parc en marchant, mais comme le maire indique, de ne pas arrêter, de ne pas s'asseoir sur un banc, etc. Et on a communiqué ça fait plusieurs semaines maintenant. Et c'est important pour assurer qu'on continue à lutter contre le COVID.
Parfait, merci beaucoup.
Merci. So last but not least, la dernière, mais pas la moindre, Kenza Beladi de TVA. Kenza, est-ce que tu es encore sur la ligne? Okay, I think she has gone offline now. So that concludes our event. This is all the time we have. C'est tout le temps qu'on dispose aujourd'hui. Thank you everyone for your time. Merci beaucoup à tous pour votre temps.
Merci. Thank you.
Have a great day.
Bye.